Thank you so much. Okay, and truly an honor to be invited back to share my work with colleagues and friends and peers in Taiwan. And special thanks to the MU team for your kind invitation. I truly agree, with the earlier presenter that compounding is a space that really a pharmacist can play a huge role in, and it's definitely an area of need, and we must not forget that, okay? And continue to improve in terms of the standard of practice and continue to be involved in the development in the space. So today, what I'm going to do is to share with you our Singapore National Compounding Project. We have taken compounding at another level, okay, and that is at national level. And this piece of work started sometime back in 2014, in fact, during my time as chief pharmacist in MOH. And this is still an ongoing project. We have not quite finished yet. If you look at our timeline later, you know that it's still many more years to go. And we work to build the hub, okay? We're still working on building our hub and establishing our regulatory levers and enforcement, and that's still ongoing. Now, I'll keep my presentation brief so that, we have more time for question and answers, all right? So this is the outline of my presentation. I will start by giving you the background just to shed to set the context and shed some lights on how this project was initiated. Then I will talk a little bit about the current landscape in compounding in Singapore and why we decide to go on a centralized model. And I will talk a little bit more on key enablers, in particular the regulatory piece as well as the governance. And then I will wrap up by sharing with you the implementation that's going on at NCCS, which is the National Cancer Center Singapore, a place where I practice and I lead, right? So I think, if you look at the details on the slides, it's all about challenges. And I'm sure this is not peculiar only in Singapore, it's everywhere. And generally, our health ecosystem is complex, and we have to navigate through primary care to tertiary care and to even specialty and community care in order to deliver care to our patient. And it's a system with many moving parts, cuts across policy, practice, regulations, and all this need to work together for us as pharmacists to deliver safe, quality, and timely care to our patient. And the system is also kept very, very busy, and it's transactional in nature. Operation cuts through many IT systems across sectors and settings. In Singapore, we are also very specially mindful about our aging populations, the increasing trend, chronic diseases, our increasing healthcare costs, shrinking workforce, and the need to transform and shift care from hospital to home, in this case, the community. And in the recent past years, Ministry of Health also it's moving the landscape, all right, and moving the whole entire sectors towards the 3 beyonds. We call them the 3 beyonds, okay? Of course, it's beyond hospital to community, beyond quality to value, and beyond healthcare to health, in order to make the healthcare system sustainable, right? Yeah, and then what? And because of the shift, all right, in the entire national healthcare system, the National Pharmacy Landscape Study was commissioned back in 2014 by Ministry to specifically look at into the pharmaceutical space and asking ourselves, what is it that is needed to transform the pharmaceutical services over the next 10 years? What is it that we want to deliver and we want to envision and to deliver to the public that we serve? So the end product of the National Pharmacy Landscape Study is the strategy bit, the NPS, we call it National Pharmacy Strategy. And it is a transformation program to help to make pharmacy services accessible, affordable, quality focused, giving our patients safer and more integrated care as well. And if you look at the NPS, it's got 5 trusts in there, okay? But I want you to pay attention to the third one, which is the redesign of supply chain. Because among all the things that we want to do in terms of our practice, in terms of our workforce, and in terms of information and technology enablement, okay, the third piece is redesigning supply chain, and where the compounding space is being redesigned, okay? Right? So there are actually 19 MPS initiatives, and compounding is a initiative under 3.1, all right? We have already delivered the centralized procurement, okay? That was 2019, we delivered that project. And we will be delivering our compounding project first hub to be ready in early first quarter of 2021. It's a bit delayed because of the current COVID situation. Otherwise, it would have been delivered this year, but it will be up by first quarter 2021. So the compounding piece fits into here. It's part of the work that we have to deliver to the ministry. Okay, so now moving on to talk on the compounding facility. So I thought maybe I should get the stage right first, okay, by making sure that we are all on the same page. Very important to the policymakers, the regulators, and the practitioners. Okay, by here, practitioners mean medical, nursing, and pharmacy, all right, to make sure that we are clear about definition as we navigate this compounding work. Because one of the challenges that I have when I started this work is like pharmacists and doctors and nurses see the definitions differently. Regulators very clear about what they want to regulate. Policymakers is stuck in between and don't know who to look to. Okay, so get the definition right. Okay, by compounding, okay, we mean processes carried out in the course of making the product for sale and supply, but does not include dissolving, dispersing the product in or diluting or mixing it with some other substance used as a vehicle for purpose of administration. Now, compounding is a professional activity performed by pharmacists pursuant to or in anticipation of a prescription for individual patient. It refers to pharmacy practice of preparation, mixing, assembling, packaging, or labeling of a medicine. Now, reconstitutions, on the other hand, is a space that, pharmacists and owners do a fair bit. And it's a process of dissolving or dispersing a medicinal product or diluting or mixing it with some other substance, such as vehicle for the purpose of administration. Okay, so the line is can be overlapping, but it's very clear what is manufacturing, what space is it, and when you talk about compounding, what space are we talking about? And same for reconstitution, right? So this is the current landscape of compounding in the public sector in Singapore. We have 6 sterile and 7 compounding facilities. Most of them are situated and embedded within the healthcare facilities, right? And of course, the current landscape also includes private hospitals and private medical clinics able to have basic facility to support their own sterile preparation and reconstitutions, in particular the cytotoxic drugs. Okay, what happened is that when you look at the current facility landscape, it does not really support economy of scale. And it's not surprising to find that some facilities are also underutilized, poorly set up, and lack of practice standards, right? So when we envision a centralized model, what is it that we are looking for? These are the system-wide benefits that we want to achieve when the proposal for a centralized compounding facility was mooted. We certainly want to build a system that is resilient and sustainable, all right? It has to be pandemic ready and built up. It has to be able to build compounding capabilities in public sector. It has to improve medication safety through the accuracy of the preparations, leveraging on technology. It has got to facilitate, okay, safe practice, okay, and has to have standard, all right? So as you can see from my point here, we're looking at robotics and machineries. We're looking at how do we embrace, okay, safe practices, and how do we embrace a GMP standard, which is the gold standard for quality and safe products manufacturing, right? And we also want to make sure that for staff who are handling hazardous drugs, okay, the effort improve their safety, right? It has to be cost saving, right? One way or another, we have to demonstrate the cost value or the value proposition for this project. And one key finding that we realize is that when we do this and we do this right and we scale it right, we are able to free up nursing time. And nursing manpower is something that we worry about nationally as well. If there's anything to reduce our nursing manpower, I think, will certainly take it up seriously, right? We want to make sure that if we can avoid cost in the future, we will do that. And potential cost avoidance in setting up new labs in our new facilities, it's something that will also be a benefit to the system. So when we envision the centralized model, we have all the system-wide benefits in mind. And so how then do we, with all our business case and business proposals and all that, and we do our financing, right? This is our first version, which we presented to Minister. And it was actually a goal, all right, to go ahead and have 3 centralized hubs. Supporting the spokes. Spokes refers to all the institutions who do not have facilities to be able to do batch preparations or compounding at a more complex level. Okay, and the hubs aim to supply compounded sterile products for co-located institutions, 100% of this volume to be delivered by the hub. And as for the spoke, all right, 80 to almost, we could 100%, but the target is at least 80% of the compounded sterile products, okay, be prepared by the hub, and the spokes can do about not more than 20% of their needs, catering mainly to immediate use and urgent preparation. Okay, and this is the 2019 approved hub and spoke model. This is because as we realized, as we moved on with this project, and we realized the space constraint within the facility, especially also in view of potential for scaling, right? It might be better to combine the 2 outstanding hubs and put them together, okay? So that we are looking at 2 hubs that would help to facilitate the transformations that we hope to see in the compounding space. Right, so this is what we're working on now, setting up the West Hub. The South Hub will be up by 2022 when NCC goes live, all right? And the West Hub will go up in due time too, all right? Yep. So when we envision the hub and spoke model, we envision that the hub is to be scaled from current public health institutions, the larger ones with capacity and capability. And the hub is also supposed to support their existing campus. There are 3 major campuses in Singapore. If you look at our healthcare facilities, one is in the south, one in the central, one in the west. All right, that's the SingHealth cluster, the NHG cluster, and the NUHS cluster. So facilities are supposed to scope to support their own existing campus and be able to distribute to designated site. It has to be designated site. Yeah, hub also to embrace GMP standards to deliver consistency in quality. And spoke is to be scaled down. Existing facilities, they do have a compounding lab, small one, all right? And we will scale them down to ensure that they are able to prepare immediate and urgent requests, mainly for in-house use only, and no distribution is allowed of sterile preparations from this spoke. Because the standards required for the facilities and it is very different in the scope in the spokes. So hub, why I say it's different, because the hub is to be set up and geared for higher standard. All right, PICS 9 is what we're looking at for the hub. All right, to be scaled towards. Okay. Yeah, so this is what we're doing. We're building and rebuilding our facilities to meet the PIC 9 standard. Whereas the hub, the spoke, you might wonder, so what happened to the spoke? Do they have guidance on standards? Answer is yes. Part of the work that we have to do in this particular project is to develop guidelines, ministry guidelines for sterile compounding in facilities, in healthcare facilities. So for the spoke, they would have to meet MOH specified guidelines in order to conduct sterile compounding. So our practice model, our proposed business model, what goes in there, and our business model includes leveraging on technology, includes how do we, scale capacity, and how do we extend services beyond public health institutions. We would also look at how the new healthcare institutions, those new hospitals that we're building, or new clinics and all that, how can they leverage on the hub, right? As well as important thing number 4, okay, is to really have resilience within our system to make sure that we can be self-sustained in the event where there is no or lack of supply, or there is a supply disruption in our system. Okay, yeah. We learned a hard lesson when Baxter pulled out in Singapore some time back, leaving some of our public hospital requesting for help from the larger hospitals to produce their sterile compounded products. So for each hub in the business model, what do we provide for them? Okay, robotics, definitely, and any machineries that they need, okay, any IT system, any digitalization that's required. This is scoped in the business case for the hub. The hub will also have a defined list of compounded sterile products with shelf life of more than 6 to 8 hours, okay, that only they will produce, okay. Potentially, okay, depending on demand, they have to operate up to 7 days a week, okay, which means it could potentially be 24/7 if we have to scale it up, all right? But so far, I think we're looking at 5.5-day operation, all right? They should, okay, hub should have ability to scope up and be able to scale up their manufacturing capacity and be GMP certified. They have to commit to reliable and timely deliver based on the service level agreement. There would be training standards, right? And and be pandemic prepared. All right, yeah. So these are important considerations and points when that is needed if you do have to build a business case. Because in everything else that we do in project, you have to present the CAPEX, the capital investment, as well as the operating model, and then the operating expenses. So all these are important consideration when we scope our business model. Okay, so moving on to the next space on regulatory, all right? In fact, I think this is still an evolving piece, and we have not really tied up yet at our end because our first hub is only up next year. Okay, but this is an evolving piece, right? And I think most of us agree that it is a very difficult value proposition to make, because when you try to look at, when we try to look at our own local risk and harm data, to try to give a value proposition, all right, from safety perspective, why it has to be done, right? It is very challenging, right? Because while most of us don't collect, and when we don't collect, we don't have data. Right? But we do know, as pharmacists, we do know that only trained personnel, right facility, all right, right practice would give us safe compounded product, right? It is a high-risk activity. And if we do something wrong, and if you're doing batch production, it harms many people at with one stroke, okay? So, and I think part of the reason why is that so because, well, it's not clearly regulated, and the different quality standards, all right, out there, and some of us pick and choose what we want to embrace, all right, and thankful that at least, in US, they did their drugs safety study, all right, and help to shed some lights and some considerations that we could present to our stakeholders why this work needs to be done. Right. So as you can see from the US study, right, SAEs are real, all right, and harm cost to patients is also real, right? Yeah. So that's something that is at the back of our mind when we do this. Okay, safety is important. And we also realized when we were doing this study that worldwide, people are actually strengthening their manufacturing and quality control practice in the space. More hospitals, compounding pharmacies worldwide, they are obtaining the GMP certification to substantiate the product that they made are of quality and are safe and efficacious. All right. So whether it's in North America, in Europe, or in Australia, they are looking at GMP. And in Europe, I think it's one of the key leading country in this, where some of their facilities are already with certification that is like any other, manufacturing facilities out there. Right. So these are the quality standards that most people mentioned in their regulations. Okay, the USP 797, 800 PICS standards 9 and 10. All right. So I have a tabulation to show you the oversight in various countries, in US, in Australia, in UK, in the Danish, in Denmark, and in Norway. So you can see what standards they embrace and how they regulate their compounding facilities, right? US regulated mostly under the State Board of Pharmacies according to the USP 797 or 800 and 800 if you're handling hazardous drugs. Australia looks at their own SHPA, okay, standards. They look at USP 797, they look at PICS 9 and 10 as well. UK, also the same, their Medicine and Health Product Regulatory Agency. Basically, they have they are looking at the space, right? And in Denmark and in Norway, in Europe, most of them are on GMP standards, PICS 9 and 10. All right. Then when we look in Singapore, all right, and ask ourselves, so so where are we? What's our practice and regulatory gaps, right? And we did two attempts. We did one in 2014, and we did another one in 2019. And these are the 4 key gaps that we identified. We're able to flesh it out to our project team to work on, right? Our regulatory space is not so strong, it's quite weak. We don't have good existing measure to regulate the compounding and distribution activities, such as hospital distributing to another hospitals compounding and selling to other clinics and all that. Healthcare institutions are also not rigorous in complying to national guidelines, which was introduced in 2016, right? And then we also noticed that people don't usually, all right, report risks that's related to the compounding practice. Hence, actual risk, yeah, we couldn't assess at all right? In terms of facilities and equipment and requirements, compounding facilities and clinics, especially the private clinics, okay, they don't meet standard, right? No proper training protocol or validation resources. Most of the staff are taught on the job. All right, so these are the 4 key findings in the current practice gap. Well, not perhaps maybe better now, but back then when we were doing this in 2014 to 2019, this was the gap. So what do we? How do we intend to move on? What do we need to do? What we intend to do? We propose to close the regulatory gaps by embracing the GMP standards in the hub. Okay, and that's why you see why the decision was taken on PICS 9, right? And was bespoke to comply to MOH guideline. And it's a risk-based approach. In our guidelines, there are categorizations on different category of products. Basically, as we evolve the way, it will be either for immediate / Cat 1 use, where it's straightforward preparations and to be used, almost immediately, or a Cat 2 product where it requires multiple manipulations, many steps, multi-ingredients, and so on. So it will be titrated based on risk of that particular product and preparations process, right? Based on GMP standards and national guidelines, the reporting of adverse event would also be mandatory, right? And on facilities, equipment, and lack in these areas issues, it is recommended that the spokes, all right, purchase the product from GMP compliant facilities, and for those who want to do this, okay, they have to meet standards. And of course, I think this is not something that to be taken lightly, because large capital investment is needed in order to operate at the GMP level, right? Although it is nevertheless a good recommendation, right? And last but not least, on training, we hope to leverage on the capacity and the capability of the hub to formalize training program and train people to ensure that some standards and validations process is available. People or staff, all right, is to be practicing in this space. And we also would look forward to collaborations with training funding agency. In Singapore, we have funds, okay, support, okay, training fund support to train staff, in particular in skilled-based activity and for upgrading purpose. So we will work in collaboration with our funding agency to deliver this piece. So on project governance, I think this is a very important piece as well, because telling people is one thing, and committing to doing it and implementing it well is another. So this two committee, it's very, very important. I will be talking and sharing with you about the terms of reference for Transitional Governance Committee and the Centralized Drug Compounding Work Group. So now, Transitional Governance Committee, it is a very senior, it's very, I call them very powerful committee, because it's staffed by very senior people, whether it's in the hospital or in the ministry. They provide oversight on the implementations of policies, governance standards as well at national level, all right? So they govern the operating framework, the contractual agreement between the hubs and the spoke. They have to make sure that the compounded sterile preparations, okay, it is a valid preparations to be compounded and be used, okay, in the facility. The adoptions of new clinical practice, like for example, pre-ordering, using dose banding and all that, basically you need to shift the entire practice in order to support the hub and spoke model. That can only be done and facilitated through the Transitional Governance Committee, right? And ensuring that the institutions involved and the service operates effectively, complying with governance standard, and take appropriate action to address areas of concern. It's also under the this particular committee mandate, all right? And the need to perform regular review and also having improvement plan is what this governance committee will oversee, right? Now, underground professional level, all right, you need guidance as well. And so Centralized Drug Compounding Work Group, which was established, I think, back in 2016, all right, has been doing this, right? And it's a professional-led work group. And what we need to do as a group, as pharmacists, all right, is to come together to harmonize our various processes and practice. So this is what the group is doing, all right, to look at our practice and processes, and we try to harmonize them, all right? Because when you reduce variations, when you bring it up to GMP level, it is easier, okay, all right, to implement and less costly as well. The implementation and adoptions of new practices and processes, all right, how do we make sure that policy translates to practice and practice translate to a real actual implementation on the ground, all right? You need to involve the stakeholders, all right? A list of compounded sterile product, it's also something that this group will deliver. We'll come together usually and we'll look through all the entire formulary of our sterile compounded preparations and decide, all right, which one should, okay, be done at hub and which one can be done in hub and which one, because of the nature of the drug, whether is it stability, all right, or and most of the time it's stability issues, okay, that we can't do it in the hub and the spoke must support, all right. The design of the hubs, because these are pharmacists and very senior pharmacists who know what's going on in the manufacturing and the compounding space. Most of them are also well informed of GMP standards. We were able to provide input on the design of compounding hubs and to ensure that the GMP standards is complied with. And then, of course, the use of technology, leveraging on robotics and all that, right? It's something that this work group will also be providing input for, right? So this two work groups set up, okay, on a national level basis, right? Platform, a national platform, right? And this is our timeline for the hubs. Early this year, you'll see SGH at OCH hub. 2022, you see middle of 2022, okay, you see NCC hub ready, and Tan Tock Seng NUHS hub, it's being planned for 2024/2025. Okay. So now I'm going to move on to sharing the implementation in the new NCCS facility. All right. We embed the setup of the compounding facility for oncology drugs in NCC. Because we know that, you know, NCC new building will be up around that time too. So the new facility has got 28-story, and the compounding hub is being built in the basement 1 of this particular building. So we look forward really to this facility. So this is the operating structure, as well as the, in a way, you know, the future structure in the new facility. The way we look at it is that this is important because you need to know the command and control right at the beginning to get the right people in to do the work now, so that when it's ready, these people can easily to take on their role in the GMP hub. All right. So we have one team that looks at people, the production, all right, and then one team that looks at the product quality, and one team that looks at the site quality, because in a GMP site, there's a lot of environmental and facility monitoring that needs to be done, all right, and you do need an engineer, a facility engineer, to help you. So this is the org structure in the proposed org structure. In fact, this has been just recently approved at the new NCCS compounding hub for cytotoxic drugs. And it is also important in our journey that we have GMP consultancy. So MOH has contracted Sterile Pharma to help us in the new NCCS GMP journey, and the consultants supposed to help us to attain GMP certification. All right. So you can see from the beehive diagram, these are all the activities that the GMP consultants have been tasked to help us. But the key focus is on the development and documentation of the compounding process and workflow to assist with regulatory audit. Okay, yeah. So we really learned a lot from these consultants, right? And at the same time, all right, this is going to be a very intense and costly project. So the support from ministry is very important. All right, especially in terms of funding support. While NCC understand our role to build and operate, okay, the facility under our branding, but we also need to commit to building it to a certain standards, okay, which is the PICS-9 standards, and we know that we will be given runway to do that, okay, very short, in fact, or 1 year kind of runway, right? And we have to work in a very cost-efficient model to supply the cytotoxic needs of the entire SingHealth cluster, which is one of the biggest, you know, cluster, the biggest, in fact, the biggest cluster in Singapore, right? Half of the island compounded sterile product requirements. MOH has supported us in building, so in CAPEX, okay, in additional things that we need to scale up, leveraging on technology and manpower as well, and has also funded for GMP consultancy work, right? What is in progress now is the financing model. So we have to work very closely with the CFOs and with the health financing team to deliver a sustainable financing model, because the delta for operating at GMP standards is very different from what we do today in pharmacy, okay? Yeah. And roles and responsibilities of project team has to be really important, has to be clarified, okay? While MOH fund the people, we need to be very clear about what are they funding these people for, what are they supposed to do, okay? So I think I've detailed a lot of words here. Apology for the busy slide, but you can see that basically expectation need to be set, delivery need to be committed. All right, and it continues, right, when the hub is completed as well. So this is our NCC timeline, all right, and as you can see here, all the little, you know, steps that we get there. It is only after a year after that we are up that we start to progressively work on the preparations for other hospitals. So we'll start with SGH because SGH is our neighbor, and then we move on to the specialty, another hospital, and then we move on to another, you know, as we progress. And the most important thing is that there is a timeline for us to get to PICS-9, all right? And by 2025, we have to get to PICS-9 standard, right? And that's our steady state, right? In the meantime, we have to work on harmonized areas of work together with the ministry work group. Yeah, and we have to then await the regulation piece from MOH and the Health Sciences Authority, the body that today regulates whether is it the clinics, the practice, or the site, or the facilities. All right. So as I look back, right, and this is my last slide, by the way, as I look back and ask, you know, what is most important message that I need to convey to the community in Taiwan if you intend to embark on similar journey? Okay, so I found the slides that helped me to be able to articulate what I wanted to say to you. All right. In fact, you just need to pay attention to the box. You know, the 3 keywords in the box, because the details is different. Okay, because Singapore is different from Taiwan. Our needs are different. Our regulatory and practice space is different. So, you know, the first point that I wanted to convey is that you need to be very clear of context and localize the issue and needs. All right, different country, you know, we have our different problems, and hence we need our own solution. All right, so be very clear about the context. At the same time, I want you to be opportunistic as well. Right, there's never be a good time. All right, but remember to be opportunistic when the time comes. All right, the new norm post-pandemic will challenge us, okay, to do things differently, and there's an opportunity to transform from our traditional brick and mortar pharmacy practice, okay? All right, don't miss the opportunity. And as we do this work, be considerate as well, okay, as you construct your business model, all right? Why I say that? Because in private space, this is business, all right, to them, all right? So you have to be considerate as you construct your business model, your service model, your practice standards, and so on. And we must, okay, build to last as well, okay, to be sustainable. All right. And my last colored box on system-wide benefit is to articulate to you that there is a need for a value proposition. Okay. And that value proposition must be at system-wide level to all stakeholders. Okay. All right. So with that, I think that's like the end of my presentation. Thank you very much for listening in, and most happy to take any questions. Right?
我可以先问一个问题哈，就是Lita 刚才I think that you just mentioned about the purpose of your national compounding project to build up those hubs. And those hubs are according to GMP standard. Was that any possibility for, I think it must be, all of those preparation will be has extended beyond usage. So is that very similar like those centralized compounding service such as CAPS in United States? And maybe they have a longer extensive beyond usage to 180 days or something for your compounded preparation. Thank you.
Yes, thank you. Yeah, exactly. Right. That's the reason why we want to set it up at GMP standards, because that would give us beyond use date shelf life that we know today. Right. You have the ability to qualify your longer stability dating. Okay. Yeah. So definitely.
So 刚才我的问题是说他们盖这个 hub 现在是准备要6个在新加坡，那都是这个 GMP 的 standard， 那他们的目标在医院里头盖这样就是 GMP standard 的 compounding room。 那像Lita 所在的 NCC NCCN 是属于这个做就是 cancer drugs 的。那未来因为这些 hubs 呢，它其实是可以把东西卖给别的医院的，那他们的 beyond use day 就会比我们每个医院自己配的要来得长得多。就是如果大家在 Google 上面打这个 CAPS Pharmacy Service 我不是替他们那个做advertisement 我就说这是一个 example， 在美国也有这些做IV 的这些就是类似这样子的公司，那你可以从他们的就是 catalog 上面看到它的 beyond use day 大概都是180天哈。So my next question to Lita is will it be possible for you to make any profit, or your country allowed to make any profit when you sell your preparation products to other hospitals?
Yes. It's not. It's definitely not a profit-making business. Okay, but definitely you cannot lose money. Okay, it has to be sustainable. So yes, we are allowed to have margin in the product that we sell, but how large is that margin is yet to be determined. So 是可以的，可是要赚多少钱，我们都不知道啊。现在，可是最重要的是survival. Most important thing is to recover the operation cost, because GMP operation cost 很贵很贵 ，OK， 超级贵了。
Hi, Lita. This is Liz Cheng from TMU. I wanted to ask about, in terms of the industry, you mentioned that Singapore reflected that maybe over-reliance on commercial support is a problem. In Taiwan, our TFDA also oversees the industry. So in their past approach, what they had done is to kind of coach the industry to help produce the products that aren't available. So I was wondering, on the Singapore side, why was it that you decided to do it more as a national compounding project rather than counseling the industry to help produce what we need?
Very good question, Liz. Okay, if we do have a private compounding facility in Singapore, we wouldn't have need to go this way. Okay, and we won't have need to develop so many hubs. Okay, maybe one is enough. Okay, yeah, but because Singapore is very small, if you look at it, Taiwan can do it, but Singapore cannot. Okay, why? Because we are so small, and compounding facility, okay, will look at business model and look at the business return. If you don't have scale, right, it is very difficult to make a business proposal that makes money. Okay, so Baxter is the only compounding facility that has ever come to Singapore market. They've been here like for I think almost a decade, but they closed their door. Okay, in 2014, around there, 2012 to 2014, they decided to pack and go. All right, why? Because they don't think that this is a business that will grow their revenue, right? Because the market is so small, and hence, because we don't have a private compounding facilities, we have no choice but to do it ourselves. When they pulled out, we realized that, gosh, we are so reliant on it, and some of our hospitals are reliant on it. And suddenly you don't have supply. Your supply is disrupted when they moved out. So yeah, and one of the key reasons why resilience is so important in Singapore public health is disruption. Okay, we want to protect ourselves against disruption, such as this. Yeah. And this is an important capability anyway. Okay, I mean, most of the compounding pharmacists will feel, the same way as I do, that it is a skill that we need to own and keep within the profession and continue to do better in this space as pharmacists. Yeah, I mean, we can be good in our clinical, yeah, but at the end of the day, you cannot deliver the product your patients need, right? Yeah, your recommendation won't fly, right? Yeah.
Thank you very much.